Hello, everyone. Welcome to my conducting a therapy session presentation. My name is Emily Roeder, and this is for my social work 285 class. Let's go ahead and get started. So to begin, licensed master social workers have the capability of providing therapeutic services. The therapeutic process looks different for every client. However, similar steps are taken by the clinician to address certain issues, and those steps will be reviewed in just a few moments. Therapy is a personal journey for clients to achieve their own individual goals. And common issues worked through in therapy are, but not limited to, eating disorder, suicidal ideation, depression, anxiety, personality disorders, women's and men's issues, grief and loss, life stressors, and past traumas. So therapy is sought out by people of all ages to help reach various goals. A lot of the time, going to therapy is a personal choice made by an individual. However, there are times in which therapy comes as a consequence of a poor action or decision created by somebody. And additionally, minors may not have the choice to attend therapy, and they may be referred to therapy by a parent or school staff to work on some behavioral issues. However, it is still up to the minor, even if they don't really understand the process, they are still in charge of their confidentiality and have the right to remain quiet or share whatever they would like to share with the clinician. So there are 5 steps to the therapy process. The first one being relationship building, assessment and diagnosis, formulation of therapy goals, intervention and problem solving, and then termination and follow-up. So each step of the therapeutic process holds equal importance. By following the 5-step therapy process, appropriate handling of a client's care can be ensured. So each clinician should follow this model, as it has been proven to show many successes throughout the therapeutic relationship. A relationship between a client and a clinician is sacred, in which it needs to follow a model to ensure safety on both ends of that relationship. Alongside that, it is also important that a clinician remains competent and follows the National Association of Social Workers Code of Ethics at all times while working with clients. So the first stage of the 5-step therapy process is relationship building. So in this process, the client and clinician have the opportunity to build rapport in order to create a successful working relationship. In this step, a clinician may disclose useful information that could be beneficial to the client's success in therapy, and that information could be anything from a fun fact about themselves to something that can be used to empathize with an issue going on if they feel it would be beneficial for the client and their process. Another thing that might be shared during the relationship building stage is strengths and weaknesses of past therapeutic experiences. That is, if a client has been in therapy before, they might disclose what they found was beneficial or what they found was harmful to their therapeutic process. So in my opinion, this stage 1 is the most important step in the therapeutic process, because it is when a client typically decides whether or not to pursue services with the clinician. This is when a client or a clinician is selling their services to the client, building that rapport and ensuring that they are capable in working together in an appropriate manner. So before the first session with a new client, a clinician may provide a free phone consultation to ensure that the client sort of vibes with the clinician. And in this consultation, the first stage of the relationship building can begin. However, relationship building will also carry to the first therapy session when a client and a clinician finally meet face to face. All right, so the second stage of the therapy process is assessment and diagnosis. So in this stage, the clinician will ensure that while working with the client, they will be practicing within their area of competence. If a client's issues go outside of the area of competence for the clinician, the client will be giving 3 referrals to seek services by a different provider. And during this process, the clinician will ask an array of questions to the client based off of their family history, past traumas, their goals, and their desired outcomes of therapy. So after assessing the client, the clinician may be able to determine a diagnosis. Typically, the clinician will not share that diagnosis with the client unless It is requested by the client verbally. The reason that this is done is to reduce the hindrance of services by putting a label on the issue that the client is seeking services for. Sometimes by giving that label to the issue or diagnosing the issue will kind of put a little bit of a burden on the therapeutic relationship, because the client will feel that they need to accomplish certain goals to get to these certain diagnosis, which is sometimes not true. Sometimes you have to take other steps to get there. So that is why it is not always shared with the client what their diagnosis is. So the third stage of the therapy process is the formulation of therapy goals. So within the first few sessions, the formulation of therapy goals will occur. It is important that the goals are written down so that working towards them can be maintained. Typically, a clinician will create a document with a list of clients' goals and desired therapy outcomes so that the client can visualize them. Typically, this can be done online through a website called Simple Practice. That is what I have heard by clinicians to be very successful through this application. Documents and forms will be sent to the client so that they can sign, and one of those documents may be this creation of goals, and the treatment intervention process treatment goals will be sent to the clients so that they can visualize what they will be working on with the clinician. And this written document can be utilized as a reference for when the goals become too difficult to reach. So if a client is feeling kind of discouraged, they can go look at this document and kind of refer back to what their goals were and the steps that they need to take to get to those goals. So in life, a client knows themselves best. This does not change when it comes to the therapy process. When establishing goals, it should be a collaborative effort between the client and the clinician. However, the goals that the client identifies for themselves should be a priority in each session. It is important that a clinician remains flexible and patient, as a client's goals can vary depending on what events may occur in their life. Now, what I mean by this is that if something happens in a client's life during the week that goes kind of against what you guys are, or the client and their clinician are already working on, then that is okay to go ahead and at the next session work on what happened during the week and kind of alter what you were working on. And this is why it takes a lot of flexibility and patience as a clinician so that you can kind of adapt to work where the client wants to focus. Stage 4 of the therapeutic process is intervention and problem solving. So the biggest time commitment of the therapeutic process is this stage. This is when the beginning of working towards goals can take place. Therapeutic modalities are implemented in this stage, and depending on the clinician's competence and specialty, that is what the therapeutic modality is determined by. And also what the client's goals are is what determines what therapeutic modality is utilized in session. So just a few therapeutic modalities are EMDR, CBT, DBT, and IFS. EMDR focuses on trauma as it alters the chemicals in the brains, in the brain, not the brains, but it's actually a really cool process, and there's a lot of information on EMDR online. CBT is cognitive behavioral therapy. It is used to kind of change a client's idea of certain things, and rather than saying, what if this and this happens, that's a bad thing, you can say that might happen, but what if something good comes from it, or that's just an example. And then DBT typically is utilized when working with borderline personality disorder patients or other kind of personality disorders may utilize DBT. And then IFS, internal family systems, is used to kind of deep dive into past family trauma and work through those issues. So another thing that is utilized by a clinician is called motivational interviewing. So motivational interviewing is defined as a client-centered directive therapeutic style to enhance readiness for change by helping clients explore and Resolve ambivalence. So the therapeutic modality that is implemented varies for each client and clinician specialty, just kind of like I said before. So during this time, motivational interviewing is also utilized. Motivational interviewing helps a client remain curious and consistent when pondering the status of their issue. For the time in between sessions, homework may be assigned by the clinician to help the client get where they need to be more efficiently. This homework kind of assignment varies based off the clinician and the client, just kind of the vibe that they give off together. That's when homework will be implemented. It's important that the client remains curious and knows that the therapeutic process is not linear. It is a personal journey that can take anywhere from several months to years to be complete. So finally, the last step of the therapeutic process is termination and follow-up. So termination can occur as a result of accomplished goals, the client or clinician relocating, financial burdens, and then the client's issues becoming too far outside of the clinician's competence or scope of practice. So if therapy goals are accomplished, termination of services will occur. Most clinicians have an open door policy, meaning former clients may reach out to inquire a session or services in the future if needed. If a client or clinician relocates, the termination of services may come as a result. There's not a national license for social workers to provide services. So if I'm licensed in the state of Arizona, but I'm not licensed in the state of, let's say, Idaho, then I cannot provide therapeutic services if a client is located in Idaho. So another common reason for the termination of services is if session rates go up. Like I said, a financial burden. If there's financial burden, then sometimes you just can't afford it as a client and you need to move and look somewhere else. During this, if there is a financial burden, there are sliding scales available depending on the clinician. To inquire about a sliding scale, all you need to do is ask your clinician if they offer one. If they do, you might get a session or a few sessions for a discounted price. Otherwise, you'll just have to maybe utilize insurance, get a super bill, whatever you feel is best for you. And then finally, if your issues go outside the clinician's competence, then it would be best to get referred out to another clinician. So in summary, there's no shame in seeking therapeutic services, and therapy is not linear. Therapy is personal to each person, and the length and number of sessions varies client to client. As a future clinician, I'm definitely biased in my opinions. However, I do know that there are a lot of people who would agree that there is no shame in seeking therapeutic services. Today's generation is breaking the stigma of therapy, and it is very beautiful to witness. Mental health services are becoming more available and at a lower cost as the years go on. Therapy is personal to each person, and it looks different for everybody. So some people may go to therapy once a month. Some people may go once every 3 months. Typically, people go weekly. Other people go bi-weekly. It all just depends on your goals and how long you want to seek the services. Also, another factor to that is how long the sessions are. Some clinicians offer 30-minute sessions, while others will offer 60-minute to 90-minute to 120-minute. So however long you feel you need to help you reach those goals is how long you should utilize those services. And so also in conclusion, it is just a wonderful journey that is personal to a client and a clinician. And it is, once again, my biased opinion, it is one of the best things that is in this world right now. So that is my presentation. Thank you guys so much for watching. These are my references. And I hope that you guys have a great rest of your week and good luck in your therapy journey.